Hey there, boys. Here's our next option for adulting skills. So this is getting health insurance. If you are not getting health insurance through your employer, then you need to get it third party. The best way to do that is to go to healthcare.gov. This is the government's official website that will do two things. One, it will bring all of the insurance plans together for you to look at them in one place, and it will provide you access to see if you are eligible for any discounts off the monthly insurance premium. So you're going to go to healthcare.gov. Doesn't matter what state you live in, you're going to start here. You've got options that say get coverage, update all of your things. There's a login. We're going to come down here and we're going to go to apply for coverage, right? And it's going to ask us to create an account. You don't have to create an account yet, but you can if you want to, or if you prefer to have it in place already. I'm not going to create an account for our little walkthrough, but you can. It just puts this step at the beginning instead of at the end. And then you're going to pick your state. If we are in Arkansas, it's going to have us fill out a bunch of information because Arkansas does all of their state-based information through this website. However, in Idaho has its own website set up. Since we are currently all living in Idaho, that's what we're going to do. If you end up sharing this video with a friend who does not live in Idaho, make sure you pick your appropriate state and follow that information on that page. So I'm going to click Visit Your Health Idaho website. And you get yourhealthidaho.org. This is the correct page. There's a few different things up here. There's a lot going on over here that will help you learn what's going on, how to enroll, coverage basics. There is a help center, special enrollment, vision, dental, loss of Medicaid, glossary, and facts and questions. So we're going to come over here and we're going to say shop plans. So shopping for plans is going to ask you some information so it can give you an estimate of what it thinks. Now, until you have created your account and put in your personal information, it is only an estimate. So please make sure that you don't count on anything until you've actually put your personal information in, because again, it could change. So I'm going to come down here. I'm going to go to continue. And it's going to have me estimate. Now, right now, it is too early to register for 2026. That starts on October 15th and runs through December 15th. So it's only going to do 2025 right now. And I'm going to say my zip code. You can see it populated with my county there. And then who all is in your household? Your household includes those people that you are responsible for. So in my house, it would be me and my spouse and the two boys that live here. If you are living with roommates, your roommates do not count. They have their own completely separate lives, completely separate bills as far as this is concerned. So only those people that you are responsible for. Now, if you ever happen to be in a situation like you were in with grandma's somebody you were responsible for, so you would put grandma on the list. So just be aware. And then it's going to ask basic information that all health insurance providers want to know. First of all, what are your ages? So I would put in mine, right? Am I seeking coverage? Just because the person is in your household and is part of your responsibilities doesn't mean that they're actually looking for coverage. For example, if one member of the family has free health insurance through their employer, but only for themselves, great, you don't need to get coverage for them. They've already got it. So then they would not be seeking. Tobacco use, you have to be honest. They will find out. They will kick you off if you lie. This covers all forms of tobacco use, whether that is chew, cigarettes, or vapes. Please be honest. Native American and pregnant. Then you can come down the list and you can continue to add people. So you can add a spouse if you're married or dependents. Dependents could be other people in your household. Most insurance plans do not consider non-legal family members as part of your household. So if you and your girlfriend or boyfriend are living together, but there are no legals, you're not married, there's none of that. They won't let you. A lot of them don't. So just be aware, most insurances only cover your immediate family that you are legally tied to. So that would be your spouse, your children, adopted children, children under your guardianship, or adults that you have guardianship of. There has to be some sort of a legal documentation saying that you're responsible for them. Okay. Add as many as you need to in here and go down the list and fill out for everybody. Making sure to put everybody on here that is relevant, okay? It affects whether or not you get assistance from the government to help pay for your premiums. So make sure that you are being as accurate as possible. Don't lie. They will find out. They take it away from you, make you pay back money. Don't do it. Don't lie on this form. This is a legal government form. Okay. So I'm going to remove that dependent line and just do myself. Then you want to have your household income. This needs to be your annual tax household income. So I'm going to close that little box. If I hover over this one, it says this is the total income for everyone listed on your tax return. So if only one person in the household is working, that's the number. If two people in the household are working and they put it all in the same tax form, that's the number. Okay. So I'm going to say 30,000 for the year. Okay. Now that's your before tax. So you don't have to know how much you're getting taxed. This is your before tax number. So if you don't know off the top of your head, you need to estimate, then you can bring up your calculator, right? Bring up your calculator. And for example, if you are working 12 hours, $12 an hour times 30 hours a week times 52 weeks. So that's your whole year. That would be your income for the year. So if you don't know off the top of your head how much your annual is, really easy to do. Amount per hour times number of hours per week times 52. Okay, then continue. Now this is an estimate again. Estimated tax credit. I have not put in my personal information yet, so this may change once I put my personal information in because it will take other things into consideration, including any previous tax filings. Okay, so now I'll come down here and go to next. Now you get a couple of things in here. You can skip these questions here if you don't have this information. You can just click this up here, skip to view plans. However, if there are certain things that you need to make sure get covered, for example, if you have a preferred doctor and you want to make sure that the plan that you select includes your doctor, you would want to put them in here. So I see Dr. Andrew Cron and have for years. So I want to make sure that I am selecting the appropriate doctor so I can get that. Then where do I see him at? I see him at this address. Okay, so now he's listed. So now when I look at plans, it's going to look for those plans that include my doctor. Okay. Go to next. How often do I go to the doctor? This is going to be everything, including routine visits, so your annual checkup, or if you're going more often because you need lab draws or anything else, you want to specify. Average number of ongoing monthly prescriptions. I currently have 3. If you don't have any, leave it at that. Add up to 5 prescription drugs. If you are on one and you want to make sure that the plan that you get covers that drug, you can go ahead and put that in. So for example, I'm on levothyroxine for my thyroid. Come down here, pick the appropriate dosage. Okay. Select your dosage. So there's my medication that I'm on, and then click next. There's also additional little things that you can make sure it has. Do you want acupuncture? It's a thing that's important to you, and children's dental. So now it's going to calculate, and it's going to look for those plans that are going to cover what I need covered. So you can see I've got my estimated monthly savings. This is how much the government is going to contribute towards my plan. They do not send this money to me. They send it to the plan, not me, the plan. Okay. There's also cost sharing reductions. So cost sharing reductions are a form of financial help that help reduce the out-of-pocket costs associated with private health insurance, which is deductibles, co-insurance, and co-payments. If you qualify for cost sharing reductions, you can only get those savings if you pick a silver plan. So we'll get into that. Okay, so there's cost sharing reductions. So silver plans, we have metal tiers down here, platinum, gold, silver, bronze. So to use cost sharing, you have to have a silver plan. The levels of these are going to indicate everything from how much coverage you get to how much you have to pay out of pocket for your healthcare. Okay, so bronze says lowest premiums, highest deductibles. So let's explain a couple of those terms. A premium is the amount of money you pay per month for your health insurance. Just like with your auto insurance, it's the same thing. A deductible, so there's a deductible. The deductible is the amount of money that you are obligated to spend before the health insurance kicks in for any of the copay or any of the co-insurance or coverages outside of these two top lines. Okay. Out of pocket max is the maximum amount per year that you will spend out of pocket. So there's a really small gap between those. You're going to spend $8,000 for that one. But once you hit 9,200, then you've capped out and it will pay 100% for everything after that. Okay. So deductible is how much you have to pay out of pocket first before the insurance kicks in. Out of pocket max is where the insurance will pay for everything 100% for the year after that. So these are yearly. Office visits have a copay. A copay is a fixed amount that you pay for every visit. So every time you go see your primary doctor, you would pay $60 on this plan. Every time you get your prescription drug, you would pay $20 for the generic. Okay, that's what those numbers mean. Network is in-network. So in-network and out-of-network. In-network means these are doctors and hospitals that are part of the approved network of places that you can go and doctors that you can receive care from to receive 100% of the benefits that you have selected. If you go out of network, that means that you can get the service you want from the person that you want, but you're probably going to pay more at a minimum than you would if it was in network. And sometimes you're going to pay 100% for their services because your insurance doesn't cover those providers. Okay. So just be aware of that. Overall quality rating. Okay. There's my drug. This one tells me right here that the drug that I am taking is not covered by this plan. So if I need to stay on that medication, I need to pick a different plan. However, my doctor is in network with this plan. Okay. As you're going through, you're going to look for those things that are most important to you. So for example, I want to make sure that I'm utilizing this cost sharing reduction. So I'm going to select a silver plan. Okay. And then it's going to filter. Now notice that none of these say 0 anymore. Okay. The lowest one here is this $42 a month. And that's because the plan overall costs more than that 410 that I'm being credited by the government. Okay. So notice these have a lot of detail on them. So Modus Select Silver 4000 Vision Exam. So this one includes vision. Okay. As I go down through here, I see how much I will pay monthly. So this would be $50 a month for me. This one has a $5 copay for office visits. So when I go see my doctor, it's only $5. My generic drugs are still 20. My deductible is only 500. Out-of-pocket maximum is 2,300. These are much easier numbers to meet, but you are paying your portion. Network, overall quality rating, my drug and my doctor are both included on this plan. Okay, you can go through the list. You can change up a couple of things. So POS is point of service, means you get to pick everything about your visit. HMO is a health management organization. They are very restrictive on where you can go, which doctors you're allowed to see, etc. But they're a lot cheaper because of that. Okay, and a PPO is preferred provider. So they have preferred providers, but you can go anywhere. If you go to the preferred provider, cheaper than if you go to the non-preferred. Okay. Most plans are these two from your employer are going to be these type. Okay. So I've got those in there. I can go down here and if I see some that I want to compare, so maybe I want to know what the difference is between this one with a $5 copay and this one with a $5 copay for the generic drugs instead. So I want to compare those two. So I'll click the compare boxes, right? And then I'm going to come over here. So there's my compare section. I'm going to click compare now. So now it's going to break it down for me in a lot greater detail. Okay. It is printable. If for some reason you don't like this look, you can print it out. Okay. So here's my two different plans. And I've got estimated expense, doctors and facilities. So that's that directory. You can see who all is available. So if you have more than one doctor that you see at a time, so maybe you've got a mental health provider and a regular doctor, and maybe you also have a heart doctor. You can check and make sure that they're all in network. Plan type, HSA compatible. So HSA is a health savings account. Basically, it's a bank account that is strictly for use to pay for your health needs. So you would put a portion of your paycheck into that account, and then you would only use it for example, for your medications, for doctor visits, eyeglasses, eye exams, dental. So any of those things that contribute to your overall health can be paid using a health savings account. Now, these are specifically monitored for tax purposes because they get taxed differently. So any money you put in here should only be used for health-related things, but those health-related things can also be things like ibuprofen, Band-Aids. So health-related things, but they don't have to be at a doctor's office. You can go to Walmart and just pick up a box of Band-Aids and use your HSA to pay for it. So there are those. Okay. Network breadth, who all's covered, overall quality rating, and whether or not your medication was covered. Okay. Was the doctor that you selected covered? If you didn't put in a medication or a doctor, there just won't be anything in these two boxes just because you didn't put anything there. Deductibles and out of pocket. This one's got a 750 and this one's got a 500. Doctor visit. How much are you paying for your doctor visit? Your regular everyday doctor, different copays. So these that have the additional information. So in-network virtual care visits are $5. In person are 10. For zero cost sharing plans, virtual care and in-person copay visits are 0. So when you're looking at these that have that cost sharing, always look at that additional information because this makes a difference, right? So if I do a video conference with my doctor instead of actually going in because I'm pretty sure I have COVID, well, that's a $5 because I didn't use their facility. I just video called them, right? If I'm cost sharing, it's not going to cost me anything to make that video call. Just be aware, check these additionals, okay? Specialist is going to be things like cardiologist, dermatologist, anything that they send you outside, if your regular doctor sends you to somebody else that specializes in this thing, that's the specialist. Other practitioners. So if your visit was performed by a nurse practitioner, a physician assistant, a regular nurse, those are different pay rates. And preventative screenings, preventative care, and immunizations in most places, for most plans, will be a $0. Okay. But there are some that do charge for it. Tests, you can see how much different types of tests are. Here's another word we haven't looked at, coinsurance. So after you meet your deductible, so if your deductible is $500, you paid all of that $500 out of pocket, now your coinsurance kicks in. So coinsurance means this is the portion that you pay and this is the portion the insurance pays. So you've paid your $500, but you need to go in and have an x-ray, okay? You will pay 40% of the cost of the x-ray, the insurance will pay the other 60. So for example, the cost of that x-ray is $100, you pay 40, the insurance pays 60. Okay. Some of them will still have copays instead of coinsurance, but that's what a coinsurance is. Okay. Drugs, you can see all of your prescription drugs. So generic is going to be, for example, Zyrtec is a name brand drug. The generic is cetirizine. That's what it means by generic. So that'd be the, the Walmart version or the Walgreens version or, whoever's generic version. Preferred brand drugs. So Zyrtec is a brand drug. If it's on this provider's or this insurance company's preferred list, the $30 copay. If they don't like that brand and it's non-preferred, you pay a lot more for it. They would rather you use one of their preferred brand or the generic. Sometimes it's unavoidable to get the non-preferred. Your doctor may specify that it absolutely has to be this one, or there might not be a generic. Specialty drugs, most of you will probably not see these, but if you end up with a specialty drug, they're $150 for this plan, 40% coinsurance for that one. Outpatient services. So outpatient facility fees and outpatient surgery and physician. So outpatient is going to be things like, I had surgery on my hand. They knocked me out. They did the surgery. They woke me back up. And then I went home. Okay. So that's an outpatient surgery. You go in, they knock you out, they do the thing, they send you home. You don't stay overnight. You don't stay all day. You just get it in and done, right? So you pay first for the facility for all of you walked into their building and you used their building. And they charge you separately for the actual surgeon and the surgical services that they perform in the building. So just be aware those are two different things. That's what those mean. ER and urgent care, emergency room, there's your ambulance and emergency transport. Urgent care is going to be like, instead of going to an actual emergency room, that's like the doc in the box that you go to when you have a sinus infection. Hospital, inpatient physician and surgical services. Again, they bill you separately for the facility to walk in their building than they do for the actual services that they perform. Mental and behavioral health. Outpatient, inpatient. Outpatient is I went and talked to my psychiatrist and went home. Inpatient is I stayed for a week. Substance abuse. Those of you that have a uterus and need to have uterus-related care, that's going to fall under pregnancy. So boys, if you are sharing this with your friends, those friends with uterus would need to be aware of this. So prenatal and postnatal care, delivery and all inpatient services for maternity care, they do separate those out. Okay. Other special needs, home health, outpatient rehab, skilled nursing facility, durable medical equipment. So that's going to be things like walkers, shower chairs, hospital beds. There's a lot of things that fall under that category. Hospice services, chiropractic care, acupuncture, rehab speech, rehab outpatient, rehab occupational and physical therapies, well baby visits and care. Most don't charge for that, so say no charge, $0 copay. So this is all of your brand new babies, new baby visits, making sure they are healthy and that they're growing right, that they get all their immunizations. Allergy testing, diabetes education, nutritional counseling, and when you get to that point in your lives, children's vision and dental. Okay. Once you have gone through, you've looked at all the prices, you've looked at all the coverages, you've made sure that it covers your medications, your doctor, whatever you need it to cover, you can click add. If you're not on that page, these all have an add button. Okay. So if I want to click this one and add this, it's going to ask me, great. Do I also want a dental plan? Now notice that some of those health plans cover children's dental, they don't cover adult. So continue to dental. Dental most likely will not have a monthly coverage by the government, but most of them aren't too terribly expensive. Some of them can get into it if you need specific things. So for example, if I wanted to look at this Guardian plan and this Humana plan, we're going to compare just like we did with the health. It's going to come in here and it's going to tell me what it covers. So dentists and dental office providers, I can click check for provider and see if my dentist is covered. Deductibles and out-of-pockets. Okay. Adult dental coverage, routine, basic, orthodontia, major dental, accidental dental. Routine is going to be things like your cleanings and your regular checkups and things like that. Notice that there's additional information and annual deductible and maximum apply to adult services. So just make sure you're aware for, if a plan has that. Okay. Basic dental is going to be things like your fillings and any, little minor things that you have to go in and get done just to keep your mouth healthy. Okay. Orthodontia is going to be things like braces. So notice that neither of these plans cover orthodontia. Okay. Major dental care is going to be things like root canals, crowns, bridges, dental implants. It's also going to cover things like dentures. So, depending on your needs, you need to make sure that you are really looking at this to see, what's covered. So this one also has accidental dental. So this is where you broke a tooth, right? You fell, you broke your tooth. You just need to go in and have them fix it so that you don't have a snaggle tooth, right? And you can chew correctly. It's not covered on this one, but it is covered on this one. Okay. And again, they do the same thing for children's. So just be aware that no matter what you're looking at, you need to review, make sure it's the right one for you. So I'm going to add a dental plan to my list here and continue on to cart. Okay. So now here's what I picked. There's the health insurance plan that I picked. Its total monthly cost, the discount that I get from the government, the assistance I'm getting from the government to help cover it, and the amount that I will be responsible for paying. Then I have my dental plan. I'm not receiving any assistance for it. So then there's health and dental in my total. So that's what I'm looking at total per month that I have to pay for my insurances. Okay. Once you've picked everything, and as long as you know that that's something that you're going to be able to do, click register if you haven't already. And then this is where you begin to put in your personal information. You will have to know all of your information, including your social security number. You will need to set up a security question that you can remember, and you will need to have a password. For those of you that are keeping password records, please make sure that you write this down immediately into your notebook, spreadsheet, however you're managing your passwords. Okay, then click submit, and it will take you through the process of getting everything set up. Now, from here, we're going to go ahead and we're going to stop this video because we're not going to look at anybody's personal information, let alone mine, because I have health coverage and I don't qualify for any of these things. Okay. Now, boys, if you have shared this with any of your friends, if your friends are in a different state and you would really please like to have a quick walkthrough for your state, let me know down in the comments and we'll get that going for you. If you have additional questions about how to fill this out, again, please ask. I will try to get to all of the questions that get asked in the comments below. All right, everybody, we'll call it a day. Have a good one.